Hello, we're here to see Dr. Aguilar.
Hello, we've been expecting you. Just a moment. Dr. Aguilar, your guests are here. She'll be right with you.
Thank you.
You're welcome.
Thanks. Bye.
Bye-bye.
Bye-bye. Tasha, good morning. How you doing? Nice to
Hello,
see you
how are
again.
you? I remember you coming to my school last year.
I remember you too. So who do you have with you this time?
This is Laura.
Nice to meet you, Laura.
This is Chris.
Chris.
And Edward.
Nice to meet you. So let me show you around.
All right.
Christina tells me that you're working on genealogies right now.
We've also been studying family trees and heredity.
And how traits get passed down through family.
Yes, I just finished my family tree.
So it seems that you've covered the whole area.
Well, she told us that you study diabetes and that you teach us more about it.
That's entirely correct. So does anybody of you have diabetes in your family?
My uncle has.
Well, my grandfather, my father, and my grandmother, and my grandmother on my mom's side.
That's a lot of it. But let me tell you, a lot of people, millions of people in the United States have diabetes. And this is a very serious disease.
How do you know if you have diabetes?
Well, why don't you all come with me and we'll talk a little bit about that.
Okay.
So, you said you came here because you wanted to learn a little bit about diabetes. So why is it that we're worried about diabetes? We're worried because it's becoming an incredibly common disease. Right now, we have about 150 million cases all over the world, and 17 million of those occur in the United States. So no matter how you look at it, 17 million people with one disease is a lot. Now, what is diabetes? Diabetes is a disease where the body cannot use the glucose that comes from the food that we ingest every day in a way to store energy. And the way this happens is the responsibility of an organ, and the pancreas has different kinds of cells, and within each kind of cell, each of them makes a different substance that is responsible for doing a different job within the body. There are alpha cells, beta cells, delta cells, and PPI cells. The beta cells within the body are the ones that make insulin. When we lose the beta cells and we lose the capability of making insulin, we end up with a disease which is called type 1 diabetes or insulin-dependent diabetes that younger kids get. And because we cannot live without insulin, what happens is that these kids need to inject themselves every day or get a pump that will deliver the amount of insulin that is necessary, like when you have the beta cells in the pancreas. There's a different kind of diabetes, which is type 2 diabetes, and that's the one that we have a lot of, not only in the United States, but all over the world. And what happens with this kind of diabetes is that we have two components that are responsible for the disease. One is that the beta cell starts failing and it delivers less and less insulin. And the second one is that as people gain weight and become what it's called insulin resistant, they need a lot more insulin to normalize their glucose levels. So when people have these two components, they develop what it's called type 2 diabetes, and most of the people develop it around their 40 to 50 years of age. One of the things that is happening now, and it's of serious concern, is that a lot of the kids that are gaining weight at a younger age are becoming insulin resistant. So 20 or 30 years earlier, they are making less insulin and having larger insulin needs. Type 1 and type 2 diabetes, it was thought several years ago that they were one disease. And now it is very clear that they're two different diseases. What they have in common is that they both have high glucose levels in blood. One of the things that people like me that work in diabetes research is interested in understanding is what causes the two types of disease, because one of the things that is very clear is that although there are families that have more than one case with type 1 diabetes, when they did, let's say, twin studies, it became very clear that although it's the most common disease, chronic disease in younger kids, it is really not a genetic disease. Because if you follow people from the same family, twins, as they get older, you can see that only one of them developed diabetes and not the other. When those studies were done in people that have type 2 diabetes, it became very clear that it had a very important genetic component, because then what happened was that it was just a matter of time for both twins to develop diabetes. So one of the important things when we talk about diseases like diabetes that can be prevented is that once you have the disease, You can't get rid of it. So it cannot be cured at this point, but it can be controlled. So if you get type 1 diabetes, the only way that you would be cured would be with a pancreas transplant. And that is a very difficult thing because the amount of kids that have type 1 diabetes is incredibly large, and the amount of pancreas that are available is incredibly small. So the probability that you're going to get one of those pancreas and really be cured is very small. So what you're going to have to do is take your insulin, follow your diet, and exercise. Now, in the last 50 years, there's been available maybe 3 or 4 different kinds of medicines that will allow you to control for your glucose levels. So what most of the patients do, instead of injecting insulin, because they don't need it, they just don't have enough, what they do is that they take a medication before every meal that will increase the amount of insulin that the beta cell produces, so that can normalize the glucose levels. So what are those common denominators? Most of these people are overweight, have high blood pressure, don't exercise, many of them smoke. So then, even if they don't have the genetic component, by having all these characteristics, they are increasing their probability of developing diabetes. One of the things that is becoming very evident is that as kids, younger people gain weight, they are becoming diabetic themselves 20 or 30 years before they should have. So that is a very serious problem. So if any of you has the genetic background and diabetes in the family, that is something you need to be concerned. Hopefully, one day we will have many of the answers, but in the meantime, adults and kids can take better care of themselves through their diet and regular exercise, and that seems to help in avoiding and controlling diabetes.